Loveline is on now.
Hello! Did you miss us? Did you notice we were gone? It's all the same if you're listening right now. It is Kevan Kenney. Dr. Tar is in the house. Producer Muggs is here. And we're going to be joined, actually, in less than 30 minutes' time with a guest. We got our first guest. Muggs booked our first guest.
Woo!
Now, Dr. Tar booked our first guest. We're very excited to speak to this individual. Dr. Joshua Gonzalez is going to join us. Now, do you want to bring people up to speed, Dr. Tar? He was a guest on your podcast.
Yes, he's the Hollywood penis doctor.
The Hollywood penis doctor.
Yes, right.
What could that mean?
You have a small penis.
Oh, that's perfect.
The Hollywood penis doctor. Muggs, what do you think it means, the Hollywood penis doctor? We're going to be joined by Dr. Joshua Gonzalez here in less than 30 minutes on Loveline. What do you think that entails?
I think he's the doctor to all the star penises out there.
What would lead you to believe that, Muggs? Could it be what we just said?
Exactly.
Oh, okay. He's just putting two and two together, getting five over there. And we're going to also answer your social media questions. That's a new addition to the show. A little later on, we were kind of relegated to the phone lines, and you can call us up. Muggs, give out that phone number if you don't mind.
1-833-LOVE-191.
Now, of course, you can do that the old-fashioned way, but we thought, there's this thing that came out like 25 years ago, maybe 30 at this point, called the Internet. We should utilize that. And Dr. Tara gave out a prompt this week. So if you are listening to us live on KROQ, or maybe you're listening on the podcast, and you submitted a question to Dr. Tara on her social media at lovebites.co, LUV bites.co. We will get to that, it sounds like, by the end of the show. I want to start, though, with I saw this happen. I believe it was on Monday. I was watching the inauguration. Was that this past Monday?
It's just Monday.
Muggs, that feels like a decade ago.
So long.
That was just 6 days ago.
January has been feeling like it's been 6 months.
Don't even get me started. Boy, do I know. And I'm watching the inauguration, and I wasn't expecting to watch this and have anything to talk about from it on Loveline. And then, lo and behold, right there on our television screens for everybody to see, Mark Zuckerberg gave me something to talk about. And I just want to say, not getting political, but Mark Zuckerberg belongs in prison. Mark Zuckerberg needs to go to Horny prison. Yes.
Horny
and do
jail.
we have a gavel sound effect? I'd like a gavel. That guy deserves... What is this like? Is this like Ric Flair's theme song?
It's Dragnet, dude.
I don't know. It feels like I'm on a ride at like Universal Studios.
Yeah, right? Now, this guy needs to go directly to Horny prison. Did you see what this guy was doing at the inauguration? This was unbelievable what Mark Zuckerberg was doing.
You mean just being a man?
I guess you could look at it that way, but this was a very, very horny man. Now, I am a very, very horny man, but I do think I can control that in situations like in a church.
At an inauguration.
Yeah, at a funeral. I'm not really going to get horny at a funeral, and I'm probably not going to get horny at an inauguration. And lo and behold, here was the founder of the Facebook, and now like sort of the meta overlord, and he was getting pretty horny on national TV. And if you didn't see this, he was seated next to Jeff Bezos of Amazon fame, and then Jeff Bezos is Jeff Bezos' fiance?
Fiance.
Yeah.
And what is her name, Muggs?
Lauren Sanchez.
Okay, and then it's so awful. You don't know when you see things online. Was she formerly married to the football player Tony Gonzalez?
Yeah, very famous tight end, Tony
That's
Gonzalez.
true?
Yeah.
Because I saw a picture and I go, she doesn't look the same. That doesn't really look like her, but that's...
She's had a lot of work.
Yeah.
Okay. Well, I mean, let's be kind here.
But she looks great.
She looks amazing. I mean,
Yeah.
Mark Zuckerberg definitely thought so. So anyways, Mark Zuckerberg says hello to her and just immediately gets I don't even know if he had said hi yet. He gets caught in 4K
Right.
looking at her breastises.
Right.
And while I am sort of suggesting he does spend some time behind horny bars, I have done this a zillion times, and I think most men do, and I've gotten into fights. I have 3 dogs. I'll walk them with my girlfriend. My girlfriend is she's very territorial, right? She's also sitting outside right now. I love you, Britt, but you're a little territorial.
You're territorial, Britt?
And so, yeah, I mean, if you thought, you'd think the dogs, if you're walking dogs, that would be the most territorial element of a dog walk with how they mark their territory. Britt is more territorial than the dogs. And so sometimes we'll cross a woman and we'll do it in the morning, and women are jogging or women are just walking. And if they're well endowed up top, my eyes will just, for a nanosecond, just glance to...
Oh, there you go. There you go. Guilty.
Yeah, 3 minutes
Guilty.
later. Now Muggs has the gavel. That's never good. So for just a millisecond, a nanosecond even, it'll just glance. Like if a car drove by, I'd go, what's that, right? And if a large object passes your eyesight, I think as a human, you will look, right? And maybe as a guy, you'll look at breasts just inherently, but then they'll dart back. But funny enough, she'll notice immediately. Immediately. And so obviously that pales in comparison to an entire nation, and thus when it got posted online, an entire world looking at Mark Zuckerberg doing what everybody does. But I argue with my girlfriend that it's not, I can't even control it. I'm not making this decision. That's just where my eyes go for, again, a nanosecond. And she still doesn't like that. She thinks it's like me deciding to do that. Is that rude?
That's a good question.
Yes.
I think rudeness is socially constructed. Like, what if we live in an alternate universe where how we say hi to each other is doing motorboats?
Imagine a world.
Yeah. Where, like, you have to put your face in breasts and to say hello,
There
you know?
is a fifth dimension.
Yeah.
I think that was a Quantum Leap episode.
Everything is socially constructed. Like how we feel about relationships, or how we feel about attraction, or how we feel about like looking at other people, and if it's like appropriate or not, is all socially constructed within our culture.
It is, but don't you think it is overwhelmingly established it's rude to stare at a woman's breasts in American Western culture?
Staring, yeah, it is.
But even
rude.
looking, is
like
it rude?
how fast?
I don't know. I mean, Zuckerberg,
Less
I guess,
than 1
wasn't
second.
fast enough. But I'll do it for, like, again, like, I swear, I'm so good now, especially when I'm around her. When I'm not around her, I linger a little bit more. But no, it'll be for a nanosecond. And I'm not trying to be rude, so I wanted to ask you, the doctor, is this pervy behavior, or is this, like, men do this?
Men do this.
Like, we can't even control it. We're sort of like, our brains, from an evolutionary standpoint, they do this.
Well, if you try really hard, you can control it, because you can control anything. Have you seen monks? Like Buddhist monks?
You don't think they stare?
I don't.
What if
I don't think they do.
can women be monks?
Yeah.
Really?
Yeah.
Do they have to be bald like those other monks?
Yeah.
Really?
Yeah.
Really?
Yeah, they shave their head. Yeah.
Wow. I didn't realize. I actually, I guess they all do shave their head. Didn't Andy Kaufman become a monk? You ever know that, Muggs?
I think he studied
You've seen the movie though with Jim Carrey. I think he's like a monk at one point in that movie.
I don't know
isn't
if he's
he?
a monk. I think he like goes to visit a monk.
I'm pretty sure he's a monk at some point in the movie, but
Well,
who knows?
but a lot of it is human nature, because, you know, men are significantly more than women to be stimulated by visual sexual stimuli.
But why do we
So-
look? Are our brains going, okay, like we have to sort of measure every potential mate?
Yeah.
Really?
Yeah.
That's true?
Yeah.
Okay.
Yeah. And because men are more likely to be stimulated by visual sexual stimuli, they're going to be looking and they're going to get more horny than women. Like women watching porn versus men watching porn, like men get more stimulated than women. I think that's why a lot of my women friends like to listen to porn rather than watch.
They'll listen to porn. They'll go on like Pornhub and they'll listen.
No. There are apps that do like audio porn. They like listening to porn, and they like plots. Like they like stories, and they like men that care.
Well, that's why they all get manipulated
But then-
by bad guys,
well-
I think. No, I'm being serious.
Oh, that
I think
could-
they're just like a sucker for a
Could
story.
be one of the reasons.
But why? Where does that trace back to? Like, why are men visually stimulated?
Well, in this study, it shows that when men are viewing porn, their amygdala is so much more active than women.
What is
So I think
amygdala?
it's a part of the brain.
Okay.
So I think it's just like built in.
But is it then?
It's
What
built in.
what is amygdala's like overall
Being
relationship?
receptive towards something.
But what is it? What is amygdala's What is amygdala's relationship to sexuality in general? Just so I understand, or do we
So-
know?
No.
Okay.
Yeah.
Well, no. I'm just saying this gets overstimulated.
Yeah.
So that's interesting to me that
Let's see.
this is a driver of like what sexual desire to some extent.
Yeah.
Okay.
Yeah.
Mugs the typing.
We can hear you.
FYI. Yeah, I know. And what is he looking up right now? I can't even imagine.
Amygdala.
But before porn, okay, like men were still probably visual.
Well, of course.
So what do you think
can
it
be
is?
Cavemen and looking at cave women.
But what do you think that is about
mean?
men? I'm just curious. Like, what do you think it is that
I think
men?
it's human nature.
But what does that date back to? Do you ever wonder? I wonder about that, where you go, like, why is it because of, like, combat, or is it because of, like, what? Well, I'm thinking about, like, just, like, early things that would differentiate the lived experience of a male versus a female.
Okay.
And how that would translate to their sexual interests. And it's like, it feels like just from the dawn of time, men were more visual and women were more, I guess, attracted
Emotional.
to... Emotional. But is that, but yeah, I guess you can divvy it up that way. I don't know. I think it's interesting.
Yeah. Well, I do think that, there are women that also lean towards being more visual. Like me, for instance, like I love getting
You like porn?
beautiful penis picture for my husband.
Really?
Yeah.
Really?
Yeah.
And some women, they think that's icky.
No, right.
Yeah, they don't like that. Now, but you said that you took some test and that you are more masculine and feminine.
Well, you can be high in both. It's not like either or. So, like, you can have, it's two different tests.
Okay, so explain
Yeah.
the test really quick.
Well, it's masculinity test as well as femininity test. It's not either or.
Yeah.
So, like, you can lean high in masculine traits, and you can also lean high in feminine traits. It doesn't mean you know
women,
what I'm saying?
yeah, of course,
Yeah.
women can have these masculine traits that we're
Yes,
talking
yes,
about.
yes.
Where, like, if you're listening to Loveline right now and you're like, well, I'm a woman and I like porn, or I'm a woman and I like getting penis pictures.
Being goal-oriented, being assertive, decisive, like some of these are like masculine traits. And I have a lot of masculine traits.
Okay, and that speaks to that.
Might explain why I like porn.
Yeah, that is interesting, though, because I feel like there is, but I don't, like, men aren't that nuanced. I heard somebody describe, I wish I remembered who did this, but it's like a male psychology is just like a door that, like, opens and closes, and then, like, female psychology is like a house with all these rooms you can go in, you know what I mean? And some lights are on and some lights are off, and they don't,
Well, I think there's something that explains that a lot is our cycle. Because you guys don't have it.
Oh, the menstruation? Is that, am I
Cycle.
saying that right?
Yes.
Okay, good. Menstruation
Good job.
cycle?
Menstruation
nice.
cycle.
My health class teacher in 5th grade is so proud of me right
She's
now.
clapping.
But yeah, it's like, it's so fascinating to hear all this about the female psychology of with sexuality, because it's so nuanced. Like, I don't think of a man with, like, all men, whatever your orientation, are probably visual. Like, I would never read a description of a Pornhub video and go like, that's all I need, Like, I want to see what's going on,
Not all men.
Really?
I have friends that...
You love saying
I have
this,
male
though.
friends. No, it's true. I have male friends that love reading erotica, and they don't even watch porn.
What are
You're
they?
rubbing your nipples.
He's just getting drops of everything
Wait,
now.
where's this from?
I compile them. Don't worry.
Would you wait? So what are those guys like, though?
Yeah, some of these guys are self-proclaimed demisexuals, so they care more about, like, emotional connection rather than, like, kind of visual sexual attraction.
But what are those guys, like, into outside of that? Because can I
What do
be
you
honest
mean?
with you? I know you're very open-minded and I love you, and that's why we love you here on Loveline. But somebody who says they're demisexual,
Yeah.
I'm gonna go out on a limb and say that that's their entire personality.
Oh my God!
Is that
You're
not true?
So judgy.
Is
It
that
is
not
not true.
true?
It's not true.
I mean, how?
It is not their entire
how-
personality, and they have a lot of other hobbies.
How barren does your life have to be of interest to even have the real estate mentally to entertain the journey to lead you to realizing you're a demisexual?
Well, to be sexually educated is not a bad thing.
Well, that's great, but
He
like,
was reading a lot of, say, Psychology Today and some research, and then he came across the
oh,
term. and
this is one guy.
we talked about it.
This is one guy. Okay.
A couple.
Oh, it's a couple. Okay. By the way, if you're listening to Loveline and you're like, he's a jerk, I'm just kidding around, man. I want everyone to be happy. I really do. I want
No,
everyone to be
he's a
happy. No. So, but wait. So the demisexual person.
Yeah.
Okay. So they're a guy and they like listening to literotica.
Reading erotica.
Oh, reading erotica, and they
Yeah.
don't like pornography.
They don't like watching.
They don't like watching it.
Yeah, it desensitizes them, which makes sense. There's a lot of men that feel like porn desensitizes them, and when they have sex with their partners, not as good because
Okay. But at one
Totally
point,
true.
Okay,
Yeah.
but I know.
Totally true, Tara.
Muggs, the more you say that, the more obvious it is that is something you're dealing with. Just FYI.
I heard it from a friend.
From a friend.
No, what I'm saying though is now, if I'm understanding this correctly, this demisexual at one point enjoyed porn.
At one point.
Yeah, of course. So then now he did it too much, and now he doesn't like porn because it desensitized him. But at one point he did like porn.
Well, he also learned that he prefers connecting with people and being emotionally connected with someone in order to like them sexually.
Yeah.
In person.
No, that's all beautiful. But I'm saying like he wasn't. It doesn't sound like this demisexual was born not liking porn. It seems like he abused porn to a certain extent, and then that's why he likes this reading erotica thing.
I don't know. I don't know if he abused porn per se.
Speaking of abuse, have you seen this movie, The Substance?
Yes.
Okay.
I love the movie.
I
I think she got some
loved
Oscar
it.
noms. I think Demi Moore got an Oscar nomination.
Yes.
Yeah.
Well, that's who's in the movie.
Well, yes.
So Demi, and then she also won the Golden Globe, I'm pretty sure.
Did she?
I'm pretty sure.
Oh, yeah. Deserving.
Yeah? Thumbs up?
Yeah.
She won
an
the
amazing
Golden
movie.
Globe. I mean, it's an amazing movie.
Yeah.
I think most movies today like absolutely stink. That was a great movie.
Oh, this one killed it. It's so unique.
Well, yeah, and it's just the way it was shot, and the female director is escaping my name, or her name is escaping me right now, but very, very talented and very. It was just almost like David Lynch. If you like David Lynch movies at all, I just thought it was kind of cool. Anyways, I'm watching this, and I was thinking about you, and I was thinking about your thoughts on this movie.
Why would you be thinking about me when you watch a monster?
Well, no, it wasn't that part. There's also other
a
parts.
monster old lady, and you were thinking about me. Thank you.
Well, no, I love Dennis Quaid, and I love you, and then Dennis Quaid makes me think of you.
Dennis Quaid. This is getting worse.
Anyways,
Let's stop.
the movie, if you don't know, it's an aging actress.
Yes.
And there's some prejudice going on with her aging. I'm trying to talk. I'm talking weird about this because I don't want to give away any spoilers.
If you watch the trailer, you'll see it too.
Yeah, all right, there you go. I don't want to spoil it because it's
She
really like an
subscribes to
amazing movie.
Some sort of medication to make her younger.
Yeah, we can tell a little bit more than that. But basically, she's an aging like aerobics
Superstar.
Yeah,
kind of like what's her name? Jillian Michaels.
Yeah, or like Jane Fonda, maybe for like an older listener. So she's like losing roles and stuff like that. So she takes a substance that's going to make her the best version of herself, and that leads to her having two versions of herself. And one of those versions is portrayed by Jack Antonoff's wife. Her name.
Oh,
Margaret Qualley.
Qualley.
There you go. And then it's this conundrum of like which side of her new life does she like more? Does she like being the younger person where she's getting all this praise? And you brought up this statement to me, Dr. Tara, that I wrote down. You said there's no one more invisible than an aging woman.
I did not say that. Someone said that.
Well, yeah, but you reiterated that to me.
Yes,
oh,
yes.
yeah. That's
I
not
was
your
asking
quote.
you, like, have you ever heard of this saying?
Right.
Yeah.
Right. So explain and expound upon that and what they meant by that, whoever they are.
Well, I mean, there is, the truth about. That's why, like, anti-aging is $1 billion industry.
Is it really?
Yeah.
How much? I'll be honest.
But not just women. Men get Botox left and right.
So Botox
we'll
is
ask
considered.
Dr. Josh after. But like men care about it. You know that guy, Don't Die Summit?
No.
What? He's like the biggest guy on the internet right now.
It's called he holds the Don't Die Summit. Spoiler alert. How many people go to this thing?
Tons.
They're all going to die.
Well, yes.
They're all going to die.
Yes.
Yeah.
Brian Johnson.
Is Brian Johnson the guy who's like 60, but he looks pretty good?
I don't think he looks that good, but
okay. But he looks pretty. The idea is that he looks
takes
good.
like 100 vitamins a day.
Okay.
And then does all these wellness things to like roll back his age,
his
biological age. But yeah, anyways, I think aging is a huge topic.
Are NADs part of that process?
Yes.
Yeah.
NRDs?
NADs.
What are
Explain,
NADs?
Tara, please.
And I mean, I don't even know
NADs?
what NADs. Yeah, they're like IVs that people get now. It's like really popular in Hollywood. People are getting NADs left and right.
Why does Muggs know about
people
this?
go get IVs, right? They get like Myers cocktail, glutathione, like whatever, and then they get NADs, and they're like $500 a pop.
Really?
Yeah.
I bet you they
It's all
all die around the
anti-aging.
same age as like the guy 50 years ago. No, I'm being serious. Like, you're
Yeah.
getting all this stuff. I just like you could still get hit by a car,
Yeah.
and you could also still like just have
On the
something
405.
genetic. Well, I mean, yeah, let's not paint the picture. But but the anti-aging. You said it's $1 billion industry. How much of that industry and those $1 billion do you think comes from Los Angeles, Miami, and New York?
All of it.
All of it, right? I mean, it's really, and that's kind of what they examine in this movie, The Substance we were just talking about, with like the entertainment industry and how they sort of dispose of aging women.
Yeah.
And it kind of examines. You were saying there's no one more invisible than an aging
Well,
woman.
have you ever heard of the term invisible woman syndrome?
No, I remember there's a 98 Degrees song called "Invisible Man." That's my contribution. That was a good song, right, Muggs?
Very different.
I don't remember that song.
Oh, it's good. Look it
So
up.
studies show that 7 out of 10 older women often experience the feeling of being invisible in society. Okay, 7 out of 10.
To
older women.
to society or to men
like
trying to
they
sleep
feel-
with them.
Well, not just men trying to sleep with them, but they don't feel desirable. And there's a
That's
whole
sad.
term that explains the phenomenon.
When was this study done? Does it say?
This
Because
one,
I think it's never
2010.
2010. All right. I don't think there's ever been a better time to be an older woman and wanting to be seen.
Explain.
Just the explosion of MILF culture, sort of post-American Pie, coining that term 25 years ago. Sofia Vergara, if I'm saying her name properly.
Yeah, but all that is all like objectification of sexy women.
Okay.
Like, what if you're not a sexy woman with huge breasts?
Well, yeah,
Are you
but
still desirable?
I mean, isn't it in the eye of the desired? Or, well, my thing is this, is that a problem in society?
What? Older
Like
women?
that women feel invisible in their older age? Is that a problem?
Yeah.
I mean, I guess it sounds like a little bit of a mental health problem, right? In the sense of like it's affecting people's mental health in
Yeah,
a bad
it
way
can-
and self-worth. But it's one of these things where how do you solve that? Because I just feel like you're going to try to to solve that is to try and rewire like male, if we're speaking like heterosexually, male instinct, human nature. And I just think human
like
nature.
male interest?
Yeah, like I just think since the dawn of time, men will probably predominantly prefer like the younger, more fertile woman, whether he realizes it or not, versus like an older woman for that reason.
Well, if you're using just evolutionary theory, like, yes, right? Because you want to have a woman who's fertile. But not everyone's attraction is based on evolutionary theory. Not anymore. Not in new society. Like I
Right.
said before, like a lot of people don't want to have kids. A lot of men don't want to have kids.
But maybe they don't consciously want to have kids, but like they subconsciously are still attracted to that younger. Because why are so many men? Well, I was just with a buddy today, and my girlfriend asked him, he's single, and he's like looking for somebody, and she's like, oh, like what's the youngest? Like she was trying to matchmake a little bit, and then he said 21, and I think he's 35. Mm-hmm. But I don't think you'd hear a lot of 35-year-old women being like, yeah, I'd date a 21-year-old guy.
Oh, we shall talk about that later.
All right, yeah, we will actually get into that later. Coming up next, we're going to be joined by Dr. Joshua Gonzalez. He is affectionately known by Dr. Tara here as the Hollywood penis doctor. Muggs made a guess that it must mean he is the Hollywood penis doctor, which is very astute of Muggs. And we'll get into what Joshua does. It is quite fascinating. That is coming up on the other side of this on Loveline.
And now, back to Loveline.
Loveline with Kevan Kenney and Dr. Tara.
Loveline on KROQ.
Yes, that is true. Everything that man said, whoever that man is. Kevan Kenney, Dr. Tara, producer Muggs is here. We're going to be joined in just a moment by Dr. Joshua Gonzalez. He is Hollywood's penis doctor.
Woo!
And what that all entails, we will get to the bottom of it, I assure you. I did want to let you know that you can text the word ONLY. The word ONLY, that is ONLY, to 20357 for a chance to win tickets to 9 Inch Nails September 18th at the Kia Forum. So if you want to go see them, that is the word ONLY to 20357 for a chance at those tickets. All right, that out of the way. We are going to do a new, well, not a new segment, but we actually have some, we have an intro to this now. Do you want to hear this, Dr. Tara? Check this out.
We do?
Uh-huh.
This is Loveline. Just what I wanted.
And now, time for Love Bites.
Nasty, aren't you?
Wow, I actually really love that. Well, Love Bites. Love Bites is a bite-sized sex research facts of the day. And today, I want to ask you, Kevin.
Okay.
Guess how many guys are happy with their penis size?
Ooh. I'm not even trying to be funny. 5%.
5%?
I think 5%.
Why so low?
I just feel like guys are stupid. We're all stupid. We
Are
all
you happy with your penis size?
I am. But
So
I mean,
you're the 5%?
yeah, but I'm older now. I'm older now. I'm more mature. I wasn't always, right?
Max, we need that voice clip.
Oh, yeah. Hold on.
That was the perfect time to do it.
Yeah, you missed it.
Don't do it now.
You have a small penis. Okay,
no,
so
but I would imagine most aren't.
a survey of 52,000 heterosexuals
Where do they find
that
Sorry, go on.
85% of women were satisfied with their male partner's penis size. So
Makes
85%
sense.
of women are satisfied with their male partner's penis size. But only 55% of men were satisfied of their penis size.
55% of men were satisfied?
So 45% were not and want it to be larger. So almost half the men in the world
I thought it would
want
be
their
way
penises
more.
to be larger. Well, some of them are lying.
Yeah, I mean, you got to know, like,
It's
we're
a survey,
Yeah, like,
so-
who was around when they asked this?
Yeah,
Were they
right.
a bunch of chicks, you know what I mean? Like,
I'm
of course.
satisfied.
No, I'm great. Wow, 55%.
Are satisfied, so 45% are not.
Okay.
So 45% want their penises to be bigger.
Yeah, I thought that would be more. I think it actually is more. I think
I mean,
there's.
that's already half.
Well, if there's one person that would know how men truly feel about their penis size, it is our guest. We are being joined by Dr. Joshua Gonzalez, affectionately coined, of course, by Dr. Tara and potentially more as Hollywood's penis doctor. And just some background on Josh: board certified and fellowship trained urologist and sexual medicine specialist who focuses on managing sexual dysfunctions in men and women at his self-named practice right here in West Hollywood, which is a neighborhood. If you're listening outside of LA, it's a neighborhood everyone knows. I think
Everyone knows West
Everybody
Hollywood.
knows
We
West
hope.
Hollywood, right?
West Hollywood.
And at his state of the art facility, Dr. Gonzalez understands the toll hormone deficiencies, menopause, arousal disorders, and erectile dysfunction can take on one's quality of life. And so Josh here offers complete general urology and sexual health care at his office to patients, many of who identify as members of the LGBTQ plus community. I was going to ask Joshua about that. And Dr. Gonzalez offers complete general urology and sexual health care at this office. Please welcome to Loveline, Dr. Joshua Gonzalez.
Thank you, guys. Thank you. I'm happy to be here.
And just for context, if you're listening on the podcast, it's 10:30 p.m. in LA, and he's here. And we gave him the option to call in, and the doctor said, no, I will make a house call. So thank you very much
You're welcome.
for being
You're
here.
welcome.
Yeah,
I don't go out on
thank you.
school nights very often. This is big for me.
Make an
Yes.
exception.
Yeah.
So I just, to ask you, just to set the table here, I hear you are a Hollywood penis doctor. What does that mean?
Well, most of what I do for male patients that come to see me has to do with their penis.
Okay.
So Tara just happened to throw the Hollywood part into it.
Of course.
Of course, I can't reveal the patients that I
Of course.
see in my office. But yeah, I see a lot of penises. Do a lot of work with penises. So
Okay.
that's what I do.
Particularly helping penises become bigger.
Bigger.
Is this true?
Harder, faster. Yeah, all of that.
So
Is that a Kanye West song?
Yeah, exactly. yeah.
It's Daft Punked, actually.
Oh,
how do you go about making a penis bigger? Because of course I remember like pumps back in the day, or you'd hear all these sort of old wives' tales
Yeah,
about hanging weights and whatnot. And I'm sure you hear this every day, the sort of skepticism. But do you do like, can you get an implant in your penis?
he's asking for a friend.
Yeah,
Right, of
exactly,
course.
Exactly. Come see me in my office.
It's across the street.
Yeah, when you see my car parked
My
out
office
front.
is across the street.
I thought he was happy with his penis.
I thought you were the 5%.
Right?
Yeah, no, so there are surgical options for sure. I am not a huge fan of those because they just, surgery comes with risk. Some of the treatments that I do in my office are, the primary one is using filler, which, cosmetic filler, the same that people put into their lips and their face to add volume. We do in the penis to add volume down there.
So
that's
that would add to girth?
Yep, it's primarily a girth enhancing treatment.
Huh.
There's not a lot of safe non-surgical options, I would say, to make erect penises longer. But the filler treatment primarily works on girth, but it does help your flaccid penis hang lower. So a lot of guys are happy with that. They can walk around feeling more confident in the locker room or at home and kind of show off a little bit more.
In the locker room.
Yeah, I was gonna.
Like-
I heard him say
Maybe
that,
it's just the locker
and I
room's not good.
said, "Man, don't let old guys at my gym find out about this because they're already too confident in the
yeah.
locker room. So the
Really?
last thing they need is to get, be
Dick
even
fillers?
more.
Oh, sorry.
Yeah, I mean, really. So when you the penis will get wider, girthier, fatter.
Yeah.
With the filler.
Yeah.
Much like cheeks do, or where else do people
Lips.
get filler?
Lips.
Okay. So, but then if you become erect, like it's the same size as it was before.
No, it's also fatter when you're erect. So it translates to like a increase in girth for both flaccid and erect, because it kind of stretches as your penis stretches and gets bigger as well.
And how long of like a runway of like research do we have on this in terms of like is it?
He's
is it
asking for a
good?
friend.
Like in terms of safety.
Yeah.
So I mean, penis filler has only been happening, I would say, probably for the last like 5, maybe 10 years.
Right.
Filler has been around for a long time.
Yeah.
So we're using the same type of filler that's been used for 20 plus years, right?
Right on.
Which has a great safety profile. But in the penis specifically, there's only actually been, I think, a couple of smaller studies that have looked specifically at safety outcomes. And it kind of matches with the safety outcomes of filler used elsewhere in the body. It's very, very safe. I should caveat and say it depends on what type of filler you're using. So in my office, we use hyaluronic acid, which is the most common type of filler that people use to enhance their lips and their face. There are some other permanent types of filler or collagen stimulating fillers that last a little bit longer, which can sound attractive to somebody, but they're also a little bit riskier to use. So if you have, an area that looks a little uneven, with the filler that we use, it's very easy to correct. You can inject it with an enzyme to kind of dissolve that a little part of it to make it look more even.
So how often do you have to get? Because filler you have to like redo it, right?
Yeah.
So how often, if you want a girthier penis, like how often do you have to go get? You're laughing, but that's what people are going for. It's not fun.
He's asking for a friend.
No. There are people that listen to this now. But are there like how often would you have to go? How often would a guy have to go?
So it lasts about 2 to 3 years.
Oh,
in the
Whoa.
penis.
Wow.
Yeah.
That's so long.
Yeah, it's actually longer than
It's actually
most people,
wider.
Most people that are doing, lip filler, for instance, are doing it a couple times a year, sometimes once a year.
That was my impression.
Yeah, yeah. So with this area of the body, we do it less often.
Well,
Oh,
we
wow.
also use the lips more, right?
Yes.
Like we use the lips all the
Yeah,
time. We
it's kind of
drink
speak for
water, eat
yourself.
food.
Yeah.
Oh, you don't drink water or eat food
I'm gonna.
or perform
say
oral
that.
sex.
He's on a
But-
strictly sex diet.
Yeah,
Yeah,
that's how I eat, man. All right,
Yeah.
that's how I put
That's how
food
get
on the table.
That's how I get my calories.
Sit down, manly man.
No, but with your patients, and if I ever ask something that violates any sort of HIPAA, please just stop me. But when your patients that come in and they ask for like this procedure, do you ever see what they have and go, "Oh man, you're fine"?
Oh, I would say most of the people that I treat are fine.
Yeah.
I mean, most of the guys that are coming in for this procedure have normal size penises, right? But it's one of those things that people end up doing to feel more confident.
Yeah.
In themselves, with their body image. They feel more confident in bed. It often translates to partners being happier because they see how happy their partner is. So
Do you think the partner is like? Because I'm just trying to picture like, is it enough where like the partner would notice? Is this something you have to share with your partner? Like,
I mean, I encourage my patients to share. They don't always do that. Some people come in sort of secret, and then
Secret.
they don't tell their partners they're getting it, and then there's a period of abstinence after the procedure because you need to like let everything.
How
kind of
long's
sit.
that?
It's like 10 days.
oh, that's not bad.
Wow, that's
But
so
if you
short.
are living with someone and you're used to having sex a couple times a week, and then suddenly you like can't have sex for 10 days, that's usually when they end up finding out.
Are most of them in relationships or single, or do you not even get that far with the patient?
I usually do ask, like, just casually. I think it's a mixed bag.
Okay.
I've seen, people that have been in long-term relationships, people that are in open relationships, people that are newly divorced and, out in the dating field and want to feel more
Right.
confident. So there's,
Newly divorced. Like, get a Corvette, get a new penis.
Exactly.
That's the new thing, right?
Yeah.
That's
better
like
dick
sports.
is the new Corvette.
Yeah, like sports car sales are going down,
Yeah.
and your business is probably booming. So when they get this, I would have an aversion to any needle like going near my private area.
Yeah.
Do you numb them?
Yeah.
Okay, so you numb them,
Yeah.
and then how's the procedure done? I mean, don't be too descriptive because we're on the radio, but like, do they lie down?
Yeah, we usually have them laying down.
Okay.
You can use a combination of sort of topical numbing creams, and then we inject them with lidocaine as well. So, but we're using, with those injections, we're using like tiny little insulin syringes. So
Right.
it feels like a quick little pinch, and then the whole area is kind of numb for a few hours, and right after we numb it, then we start putting in the filler. We use needles to do that.
Okay.
But you don't feel any of that. So,
Yeah. And then it doesn't affect like urinating or anything like that? Okay, that's
Yeah,
cool.
no.
And then do you ever, not that this would be like self-evident, but do you think, or have you found that more people are heterosexual, homosexual, like in terms of the
it's a good question.
for this procedure?
My practice probably, I see a lot of gay men in my practice. I would say for this particular procedure, it might skew a little bit more straight.
Interesting.
But it's a mixed bag. I mean, I definitely see gay and straight men
Right.
for sure that are getting this done.
That's interesting.
Yeah.
Wow. And so how did you like get into this line of work?
Dick plumping?
Well, I mean, eventually we get to that point
Yeah,
as like
yeah,
something
yeah.
you offer. But I'm
Urology.
curious, like
Urology, yeah.
as a kid, as a kid, you just want to be a doctor.
Yeah, I walked up to my mom one day and I was like, I
Penis
want to take care
doctor.
of penises.
Yeah.
No, I actually didn't know what urology was when I went to medical school.
What is? I still don't. So what is urology?
So we are like doctors of the genitourinary tract. So that's everything having to do with like urination.
Okay.
And like your genitals.
Okay.
Basically. So, for most urologists are treating primarily men. So it's everything from like cancer involving like kidney, bladder, prostate, penis cancer, testicular cancer, to like guys just having trouble peeing as they get older.
Right. What's
and
up
then-
with that? I hear that. Like when you get older, you can't pee. Like you're like stoked if you peed.
Yeah. So your prostate is one of the organs in the body that continues to grow throughout your life, right? So most of our organs grow to a certain point and then they just stop, right? Like, but your nose gets bigger your whole life, your ears get bigger, and your prostate gets bigger. And as it gets larger, it starts to obstruct the outlet of the bladder where your urine comes out of.
Oh.
And so it's sort of like you're pinching off the hose.
Yeah,
right?
yeah.
So the hose isn't as wide and you can't get the urine out.
So question for
I have
Dr. Tara.
I have a question too.
Can I ask you a question really
Sure.
quick? So if a man, an older man, has a larger prostate, does that mean he has like a larger G spot, or can he get more pleasure out of the prostate if it's larger?
Well, I guess there's more area to massage, right?
Yeah. I don't think that there's like a correlation between prostate size and sensitivity.
Right.
Because
you could
there's
have
a
a
lot of-
huge one and not sensitive,
And
right?
there's a lot of like younger gay men with like prostates that are probably pretty small that are really enjoying anal sex. So yeah.
That's interesting. Wait. Say that. Like, what do you mean by that?
Well, when you're younger, your
He's
prostate's
asking for
like
a friend.
small, right? It's like a small 20-gram little walnut.
Yeah.
And just because it's a smaller prostate, like that doesn't mean that someone can't enjoy anal sex from just having that area stimulated.
Right.
Yeah.
Gotcha.
So-
yeah,
well,
like it can still be sensitive.
Exactly.
Yeah.
Do you ever see old guys at these like sex parties you go to, Dr. Tara?
Yes.
How old? Like old enough where they might have prostate issues?
Yeah. Oh, yeah. Definitely.
What's the oldest? How old is the oldest guy you've seen?
I don't go up to people and ask, dude, how old are you?
Yeah, but if you had to, like, if I was at a diner right now and I'd be like, that guy looks like he's 100, or that guy looks like he's 60. Like,
Okay.
What do you think's the old? Have you seen an 80-year-old?
No.
You haven't seen an 80-year-old, but
Oh, like on porn?
no, at these sex parties you go to.
No.
So what about 70-year-old?
You've probably seen a 70-year-old.
Potentially, yeah.
Yeah, have you
There's
seen?
a lot
Have you
of good-looking 70-year-olds in
Yeah.
LA.
Well,
Yeah.
now it's so crazy.
Yeah.
You ever
Like-
think about like what a 70-year-old
Yeah.
was when we were kids?
Oh my god.
And it was
Really
like,
old.
and
Like
now
Golden
Yeah.
Girls where they were like in their early 50s.
crazy,
Yeah.
crazy.
That's like Halle Berry.
If you ever need to like balance yourself out, if things are just going like amazing for you and you just need like a humility check, look up the ages of the Golden Girls.
Yeah.
And you'll just go, wow, all right, I'm just going to chill out for
Yeah,
a
I'm
second.
almost there. Yeah.
It's crazy. But like there are really good looking 70-year-olds nowadays.
Yes.
But have you ever seen somebody at a sex party, Dr. Har, that you were like, that's somebody's grandpa?
Yeah. Oh, yeah.
Really? Have you ever seen somebody that was like somebody's grandma?
Yeah.
Really?
Yeah.
And what were they like? Don't be too descriptive. Were they like getting down?
Yeah.
Really?
Good
yeah.
for them.
Yeah.
That's
I mean, have you
amazing.
been to Burning Man?
No, but a girl actually like kind of broke up with me over Burning Man one time.
Oh.
Well, because she went to Burning Man. I met this girl on an airplane, and then we were kind of hooking up, and it was kind of awkward. And
You didn't end up getting married?
No, I didn't wind up getting married. I'm not married now. What do you?
I met Brent on the
You gotta
plane.
stop
And we ended up getting married.
Oh, okay. I was like, what is this joke? Anyways, so I was seeing this girl, and then there was like some time we didn't talk, and then we were catching up, and she told me she went to Burning Man. And I think, from what she had told me, the most interesting thing in Burning Man is there's a dome, and you go in the dome, and you can just have sex, like, if they
Yeah.
consent. And I'm like, that's fascinating.
Yeah,
So
the
anyways,
orgy dome.
The orgy dome. I was like, that's crazy. I've never heard of anything like that.
Must smell good in there.
Oh, yeah. Smells delicious.
I don't think they like guys that look like you in much.
I like it. Smell of liberation.
But my point is so then we left after having these drinks, whatever. We didn't hook up or whatever. And she texted me. She's like, hey, like, I don't want to see you again because you like objectified me and made me like uncomfortable. And this is somebody like I knew, and I wasn't being gross about. I was just genuinely like fascinated of like how it worked and whatever. So that's my only connection to Burning Man. And then I felt bad when everyone got stranded there recently.
Well, yeah, I know. But I said that because when you go, you meet quite a few of these older people that are very like liberated and they're like naked. And
But those are cool grandparents. I'm
exactly,
saying, like,
but it's
have
the
you ever?
same people
Yeah.
that go to the
I mean,
sex parties.
uncool grandparents aren't going to sex parties.
Right. I'm trying to get at like, have
Only
you ever
cool
seen like a
grandparents.
guy?
Only cool grams.
Exactly.
So have you seen somebody at, let me put it this way. Have you ever seen somebody having sex at one of these sex parties that if you saw them outside of a Ralph's, you would hold the door for them?
Yes.
Really? That's crazy to me.
I'm just polite.
That's just fascinating to me.
But yeah, I have a question. I heard this a lot, but never from an actual source. Just like, TikTok, whatever. And they say like if you live long enough, you'll eventually get prostate cancer.
Yeah, that's true.
That's true?
Yeah.
What age is
there was
that?
a-
Men, if you
What
live
age
long
is
enough, you
that?
get prostate cancer.
Think about it like just it's pretty easy to understand. So cancer is just unregulated cell growth, right?
Right.
So if you have an organ that continues to grow throughout your life, it is at risk for developing cancer. And they did like an autopsy study. This is like a long time ago because I remember reading about this when I was in medical school, and that was already like 20 years ago.
Oh, really? I thought it was
know.
last year.
Oof, I wish. But yeah, so in autopsies, like specimens, they looked at men, and like 80% of the cadavers that were in their 80s had prostate cancer when they did the autopsy. But most of those men die of other causes. So it's a very slow-growing cancer for most people. We screen men, pretty early, starting around age 50. And it's a very curable and treatable cancer. So it's, if you are unfortunate enough to get a cancer diagnosis, a prostate cancer diagnosis, it's one of those cancers that's like pretty treatable.
When should men go get tested?
For prostate cancer?
Yeah.
So around 50 is usually when I tell my patients, if you're someone who's at like greater risk than the average person, like if you have multiple family members who've had prostate cancer, you may want to consider getting screened earlier. Black men are at increased risk of prostate cancer, so they probably should screen
Really?
earlier than other men.
Why
Yeah.
is that?
It's probably just like genetic. Yeah, because it's
What is it about like black people?
I don't know.
It's just a thing.
Yeah, that's one of
Statistically
the.
from
I mean, there are
the
certain
past.
cancers that like Caucasian people or Asian people are more at risk for. Like stomach
Really?
cancer, for instance, is like more common in Asian people.
It's the food that we eat.
Yeah, I mean, it's probably related to something like that. Yeah, these cancers that are like more prevalent in certain communities, it's not fully understood why that is the
Wow.
case. But yeah.
So what cancers are for white people?
Most of them actually.
Oh no, like skin cancer.
Yeah, for sure.
Yeah. Oh, well, we're learning a bunch about
Yeah,
cancers. But
that's-
yeah, if you live till 80, Kevin, you'll get prostate cancer.
That's pretty
Yeah.
crazy.
Yeah.
I always think of these people where they just like they die and people go, "What happened?" Oh, they were just old.
Oh, I have a fun fact about prostate cancer. If you want to reduce your risk of prostate cancer, come more.
Really?
Oh.
Yeah, there was a study that found that men who ejaculated more.
Orgasm.
Keep going.
Oh, okay. Yeah, men who ejaculate more are have a reduced risk of prostate cancer.
Interesting. So that is good. Now, but there's a balance, right? Because now I actually love having you here because it's like two sides of I think a lot of curiosity for the Loveline audience. So you're saying that it's better to come more, and then is he dump? Well, you got to tell me if you're dumping me. Are you dumping me?
Yeah, use the medical term.
Okay.
Yeah.
Are you dumping me?
Yep.
Okay.
Yeah.
We're done. We're over.
We use ejaculate.
All right. So you're saying that men that ejaculate more, it's better to avoid prostate cancer. Now, what about some of the callers we've heard from that are these like chronic masturbators that are probably doing that a lot? So maybe their prostate's healthy, but then that's not good for them overall.
Well, I mean, I'd always say that daily masturbation is healthy, but then there are people that are like calling it was like I masturbate like 10 times a day,
Right.
and it becomes a disruption to your life,
totally.
not necessarily
you
like
can't,
bad for your health.
leave your
but-
house because you're masturbating too much. Probably
Canceling
too
plans.
much.
Yeah.
Yeah, there's a nice little song. That was like I think I didn't realize the depths of that. Where I've gone through times in my life, I'm like, I'm probably watching this a little too much. I probably shouldn't be doing this, right? But like we've heard from people, doctor, that like cancel plans.
Yeah.
They'll like,
People just love masturbating.
Yeah. I mean, it releases stress. There's a lot of
Yeah.
benefits to masturbation for sure.
Yeah.
And I don't ever like put a number on it. Like you should only masturbate this many times per week or whatever. But it's just like with anything else, right? Like if it's serving a purpose for you and it's a healthy practice for you, great, keep doing it. If it's something that's interfering with your ability to sort of do daily tasks or seek out sexual or romantic relationships, like then it's you probably have a problematic relationship with masturbation.
So what else do you offer? If I'm using the proper vernacular, well, so what else do you offer at your practice?
Yeah, so I mean, it's basically like a comprehensive sexual health practice. So we treat patients of all genders for a variety of sexual health issues. So like the big ones would be things like erectile dysfunction, premature ejaculation, low sexual desire. I do a lot of hormone replacement therapy for men, so that's like testosterone replacement therapy. I treat perimenopausal and menopausal women with hormone replacement therapy. I have a lot of patients who have pelvic pain or experience pain from sex. So we treat both, both of those issues as well.
Sorry, Kev. Dr. Josh, before you go, gas station boner pills, yay or nay?
Stay away, please.
Why do you say that?
So they're not regulated, right, by anybody.
So how can you sell them if they're not regulated?
You can sell a lot of things with
Really?
that are not
You can
regulated.
sell anything.
Like I just found out that like the nicotine Zins are now regulated, but
Yeah.
before they weren't regulated.
Yeah,
and
yeah,
I'm
yeah.
going, how did they legally sell that?
Yeah.
I mean, you can sell anything. If you go on website like I don't know, Etsy or something, like you can make like at home products and sell them.
Like guns.
Like pharmaceuticals? I don't
Yeah.
think you're,
Oh, yeah.
Who's selling
Tinctures.
pharmaceuticals?
Yeah,
Tinctures and
tinctures,
potions.
like
That's
heal.
different than like pills.
No,
But-
I mean the gas station supplements. They've had some studies where they've actually taken them and analyzed them in a lab, and like they can be not to say that all of them are, but they can be full of like caffeine. Sometimes they have like rubber particles in them, and sometimes they
Really?
have actual pharmaceutical medications in them. So they've found that some of those actually have sildenafil, which is the generic for Viagra.
Really?
Yeah. So, people are taking these things thinking they're like an all natural way to like enhance bedroom performance, but sometimes they have
Just like low dose Viagra.
exactly, but
Yeah.
but Viagra is not a medication that everybody should take, right? There are contraindications to taking the medicine. And so if you have somebody who falls into that category and picks up one of these boner pills, takes it, they can have like a serious cardiac issue. You know what I mean?
So with like obviously more young men than ever are taking like the sildenafil.
Yeah.
Yeah.
So with anything, it's going to get abused.
Yeah, yeah.
Right. And especially like with like young people. Do you know what happens with like such a thing as like Viagra abuse?
Good band.
I don't see a ton of Viagra abuse because most of the men that I do see actually a lot of young men with real erectile dysfunction. So like they need the medication. So I wouldn't really classify it as abuse. I'm sure it happens. I just don't, given the nature of what I do, I see patients that have a real problem. And that's one of the solutions that we give them.
How do you treat like low? You said something low arousal,
Low libido, or low sexual desire.
Yeah, like low sexual desire. So
Yeah.
not erectile dysfunction,
Right.
but low sexual desire.
Yeah, so in men, low desire is often related to erectile dysfunction. As an example, in like the Viagra trials in the 90s, right? Men who took Viagra in those studies reported improved erectile function, but also improved sexual desire. So there's a very clear association between erectile function and libido, but they are actually separate phenomenon, right? So there are some men who have totally normal erections and have no desire for sex, and there are other men who have a lot of desire for sex, but their penis just doesn't work, right? They can't get hard or can't stay hard. So you have to kind of address both issues.
Interesting.
Yeah.
So we unfortunately have to get to break, Doctor. But where is like the best place? Of course, on Instagram, you are Joshua Gonzalez, MD.
Yeah.
And is there anything else you'd like to like let the listeners know, both here in LA and people who listen to the podcast?
Yeah, I am always trying to advocate for people to find solutions for sexual health issues. So I think, if you're someone who is struggling, not having good sex, want to have better sex, having a problem with sex, seek out solutions. Follow me on Instagram, on TikTok. Go to my website, joshuagonzalezmd.com. There's a lot of just like helpful information there that may not apply to you, but maybe your partner is dealing with that problem. So
Yeah. Well, thanks so much for taking the time.
yeah, thanks for having me.
We got to
Thank
chat
you.
again soon. This was
Yes.
great.
Yeah.
We'll be back with more Loveline.
This is Loveline.
What up? Hour number 2 of Loveline. If you're listening on the world famous KROQ, and just the middle of the podcast, I guess. If you're listening on the podcast, it's Kevan Kenney, Dr. Tara, producer Muggs is here as well. Last hour on the show, just to bring you up to speed. For those listening on the radio, we were talking about Mark Zuckerberg. Man, he is just too darn horny these days, staring at Jeff Bezos' fiance's breastises. We talked about The Substance, the movie The Substance with Demi Moore, which kind of ties into that's unfinished business. We'll get back into that in a moment. And then we were just joined by the amazing Dr. Joshua Gonzalez, the West Hollywood penis doctor that we learned. I learned more from that guy than anybody I've
Your
talked
health
to.
class?
Yeah, that was fascinating. He's
Yeah.
he's a doctor here in West Hollywood, Los Angeles. He will offer filler treatment.
Yeah, penis
for
filler.
penises, where you
Yes.
can, if you want a girthier penis.
Yes.
You can go to Dr. Joshua Gonzalez, and they've got that service. It is lasts 2 to 3 years too, which I think is a great deal.
He's my go-to person to call for all penis questions.
Yes, and then as we hear Muggs' computer, which is insane.
He's calling Dr. Joshua
I know,
Gonzalez
he's
to
calling
make an
him
appointment.
right now.
Make an appointment.
And then also Dr. Joshua Gonzalez does a whole heck of a lot more than that.
Right.
So if you got any sexual health needs here
Yes.
in the West Hollywood area, please, or just Los Angeles,
Go to his practice.
check him out. Now, earlier last hour, as I mentioned, we were talking about this movie, The Substance. It stars Demi Moore, and it really examines how messed up this industry of Hollywood can be with aging actresses specifically, and specifically if you are the aging actress, as Demi Moore portrays in the film, that may have been known as sort of like a sex symbol,
When they were younger.
Yeah, when they were younger, and then how that affects people. And, the movie is quite grotesque, but I think in a very important way, because they present these visual grotesque things to sort of display how grotesque the behavior is towards aging women in Hollywood. So we were kind of talking about that, and I was contesting that it's never been a better time to be an aging woman because of sort of MILF culture, and because of the celebration of older women and their beauty. Even I think Pamela Anderson now not wearing makeup, I believe, is like this sort of stance she's
so
taken.
beautiful.
She is very beautiful, and I think it's a good time. And then you brought up this three named person that I am not familiar with.
Named
Now,
person?
Muggs, can you name a 3 named person? Who do you think we're referring to?
Jonathan Taylor Thomas.
That's what I was gonna say. That's what I thought. I go, who's a 3 named person I know, and it's the same actor from Home Improvement. So clearly, Muggs and I get out. But no, this is Aaron Taylor Johnson. Okay, and before I even explain why we're talking about ATJ, does anyone call him ATJ?
No.
Okay, ATJ.
Nobody.
ATJ. There's a drop. ATJ. Before I even talk about why we're talking about Sir Aaron Taylor Johnson, who is this?
Okay, so Aaron Taylor Johnson is a huge Hollywood movie star.
Why have I never heard of him?
What?
What movies is he in?
The Bullet Train with Brad Pitt.
Okay.
Have you seen it?
No. Wasn't
he's
that like,
so
I don't even
hot.
think that was
He
in
is
theaters.
Extremely attractive.
Was he opposite Brad Pitt, or was he happened to be in that movie? Like, was he
What do you mean
starring?
opposite?
Well, you can star in a film, or you can be in
Yeah,
a film.
he's one of the main ones. He's not the leading because he's not Brad Pitt.
Yeah.
But he's one of the main
Okay,
ones.
so he's
yeah.
in Bullet Train. Anything else?
That movie, what is it called? Like Craven?
Craven.
Yeah.
Have you ever heard of this guy, Muggs?
Now that I looked him up, yeah.
Okay,
he's
you have.
he's in Nosferatu, Kick-Ass,
I don't know any of these movies.
28 years later.
Well, anyways,
Anyways,
he's very attractive. And
he's very attractive. Paint the picture in case anybody knows that. So he's how old do you think this guy
So
is?
he has like long curly hair.
Well, not that descriptive, but he's an attractive guy, and he's how old do you think he is?
I think now he's in his 30s.
Muggs.
Now he's
Muggs,
in
how old
his
is he?
30s.
He is, 34.
Okay, so he's
Yeah.
34 years old, and so that's kind of plays into why we're talking about this guy. So he has a huge age gap with his
Yes.
wife.
I thought you were going to say
Sam.
something else.
So this is
Sam Taylor Johnson. Yes.
whoa, wait. Her name is Sam
Sam.
Taylor Johnson.
Yeah,
I was like, what are the chances that he dated or met a woman with 3 names? So, okay, he's Aaron Taylor Johnson. She's Sam Taylor Johnson.
Yes.
Okay, so this age gap is described as huge. How big is the age gap?
23 years.
23 years. So he's
23
34.
years. So
He's-
they met when
Well, before we
she-
even get to that, he's 34. So she's 57. Now, Muggs, how do you feel about that?
I mean, that's what he's into. It's whatever floats his boat, right?
Could you ever do that? What do you think is the biggest age gap that you've had with a woman you've dated or slept with?
8 years?
That's it?
Yeah.
That's you never tried like the
Wow.
cougar thing. Why not?
I didn't.
Wasn't your thing?
No, I wouldn't say it wasn't my thing. It's just I never came across the opportunity.
Really? All the bars you go to in the valley, there's not a cougar bar?
Well, yeah, but like, I mean, I'm not actively pursuing the options
For cougars.
there
Okay.
where I go.
You're
And never
being
on apps?
so
You never
careful
like
right
slid
now.
you never slid the date range up just like, you're drinking one night, you're like, let's have a night. Let's see what happens.
I did an app
That's
once.
terrible.
I did an app once, and I
What do you
never
mean you
did it again.
did an app? What does
Yeah,
that mean?
I partook in an app.
Oh, you signed up?
Dating app.
Yeah,
Oh,
and I
really?
did. It was just not.
It wasn't for you?
No.
What didn't you like about that? You're a writer. You're creative. Why didn't you like being on an app?
I didn't know that was all about writing and creativity.
It is
that's
not
what-
about writing or creativity.
Well, you guys are crazy. Are you kidding me? People's aversion to those things a lot of the time is they don't like to write about themselves or they don't like to text. They just like to meet people. So I'm saying, what did you not like about it?
I think a lot of the times, and not on my end, but on the other end, like sex was expected. Like,
And you didn't like that?
not on all of them.
Oh, okay.
You don't want to
Really?
just be
and,
like a.
and you can't tell. You can't tell by the pictures, really.
No.
you can't ever.
But that's interesting that you didn't like that sex was expected
Like I said, not with the person.
with the people.
Yeah.
Oh, is it a person? Is there like one that was real bad?
I wouldn't say they were really bad. I just didn't. I didn't have.
You
any,
had a bad experience with them.
No, I just didn't have a desire to have sex with them.
Wow, but it was bad enough where you didn't want to do the apps anymore.
Yeah, dude. It's,
What are we talking about here? Like, what do you mean by bad?
It's just. I mean, it wasn't.
It was an uncomfortable enough situation where he said, you know what, I don't like this and I'm never doing this again.
Yeah.
He also doesn't have a problem getting laid. No, he really doesn't.
Yeah, you told me.
We've talked about it on the
Yeah.
show.
Like he owns the bar.
I don't know if he owns
Let's
the
not-
bar, but-
let's
no,
slow
I just
down.
think
Let's slow
women meet him. Women meet him, and maybe you can like shine light on it. He's just like a lovable guy. You feel safe
Yeah.
with Muggs. Like, do you know
Yeah.
what I mean?
Yeah.
And you're not safe with
I
Muggs.
feel
That's the
safe
magic
with
trick.
Muggs.
But you feel safe with Muggs.
Oh, good
Yeah,
to
I
know.
escort Tara out every night. Oh, well, every Sunday night, rather.
to my car.
Yep.
So you're saying I'm not actually safe.
Well, yeah,
Yeah, you're fine.
I wouldn't trust him as far as I could throw him.
Okay.
But so, anyways, he's never dabbled with the older ladies. 34 years.
So they
Is that what we
met-
said? 34 years?
What do you mean?
No, he's 34.
He's 34.
Yeah.
What's the age gap?
23 years.
23.
Yeah.
Okay. So when did they meet?
They met when she was 42 and he was 19
How does that happen?
at a movie like audition.
At an audition?
Yeah.
Well,
At a
were they
movie
both auditioning
I
or was she
think they
casting?
I think they were both auditioning, not for the same role.
Yeah, of course. No, of course.
Yeah, but I think they were both trying to work on a movie,
And
then they literally fell in love. And just 1 year after meeting, the guy proposed to
Okay.
her, and they got married.
So there's a lot of things wrong with this relationship. A lot of
Not
question
according
marks.
to what they say.
Well, what do they say?
So he said, I just know that it works. I just feel secure and loved and safe. We have a very deep connection and we're just in sync.
When did he say that? How long into the marriage?
Recently.
Was that on the
He
honeymoon?
said that recently. And they have a kid together too.
They had a child together. Wait a minute. So
Yeah,
she
she
how
got
old was she?
pregnant.
How old was she when they got pregnant?
I think just 2 years after that.
So like
marriage.
mid 40s though.
Yeah,
That's pretty
yeah.
impressive. That's pretty good. God bless them.
Well, I guess with a 22-year-old sperm.
Yeah. Is that true? Do we know if that's true? That like younger sperm is stronger and better?
Well, yeah.
Is it? Or are we just assuming?
I'm assuming.
We're assuming.
But younger can also mean healthier, right?
Yeah, that is true.
'Cause as you get older, you tend to have
Oh,
more
definitely.
illnesses.
So my question is what do you think that's about? I mean, because what's like? Do they talk about like is his mom in the picture?
They're not talking about his family.
Okay, because I think this is all
you theorizing about
Yeah,
his
I think
mom?
this is 110% about whatever he went through as a kid. That he would at 19 be that emotionally. Because I'm not saying he's not attracted to this woman. Of course he is.
Right.
This is the love of his life. It sounds like, but to be drawn and to relate to someone at 43 years old. Or I'm sorry, he's 19.
He
20,
was 19.
23 is 42. Yeah, 42 maybe.
Yeah.
So it's like, yeah, like something happened in your life that kind of set the table for you to go and do that. You don't think so?
Some people find themselves extremely like emotionally mature, more mature than people in your cohort.
Yeah, but he's an actor, right?
Right.
Okay, so a 19-year-old, every 19-year-old has a void in them, right? It's why we go out to college. We try to prove, like, we
Find
try to
ourselves.
we try to make our parents proud. We
Yeah.
try to get a degree to become something, to make something of ourselves. Or, like your parents never loved you, and then you want to go be famous, and you want to be, and prove them wrong, kind of thing. You have a void as a 19-year-old, no matter who you are. An actor every actor has a void in them where they need to please strangers, and they have this desire to sort of be other people. Right? Like acting is like they want to be other people and they enjoy that art. So a 19-year-old actor has a massive void in them that obviously this person filled. So that's why I'm saying I don't think it's just like, oh, like this person spoke to this person. I think they probably healed him in a way from something that happened obviously like earlier in his life.
I don't know. I feel like it is also a potential that, when you're very emotionally mature, like much older than your actual age and much older than people in your cohort, girls your age, you might feel like it is a lot more intellectually stimulating and sexually stimulating to date older women.
No, I think dating older women is amazing. And I've done it plenty of times when I was
have?
single. Absolutely.
What's the oldest?
I don't know. I mean, I wasn't courting them.
Well, but like an estimate.
Like up there, probably.
50?
Yeah, easily.
Whoa.
Easily. No, but I am somebody that like fashions themselves a bit of an old soul, and I don't know, just like I have mature interests, maybe. I don't know. I'm not saying I'm mature. Everyone listening to this that knows me goes, that guy's not mature. But no, it's like I relate to older people a lot. And so that resonates with me, but I'm not going to marry these people. And I certainly wouldn't have married them at 19. So I'm just saying there was a deeper connection made there that I'm just fascinated, like what his upbringing was like that led to that.
That
you know what I
is
mean?
interesting. Maybe Muggs can help us.
And
figure out his
can
upbringing.
I take it a step further? I think the reason why Muggs doesn't maybe have that interest in older women is that we've learned on Loveline, if you listen to Muggs, Muggs, he's the caregiver. He wants to be the caregiver.
He's a fixer.
Yeah. So like he doesn't want someone caregiving for him, right? But
Do you want someone to caregive you?
Yeah, I think so. I don't want to be fully the caregiver. I would like to. I like reciprocation, right? 50-50.
Yeah.
I don't like to be fully taken care of, but I also, want to take some care of whoever the partner is,
And just like Bono, he still hasn't found what he's looking for.
Wow.
So an interesting research found, and even though we've been talking about like quote unquote aging women, research found that actually older women that are like older than 35 tend to feel the most sexually assertive and at their sexual peak. So when it comes to the phenomenon of older women dating younger men, oftentimes the younger men will feel more desirable.
Well, this is
with older
110% true.
Yeah.
But do you think that there's any negative to the younger men fetishizing the older woman sexually for
Well,
the
if
novelty factor, and then the older woman in like sort of internalizing it as some sort of like self-validation? Is there anything bad about that?
Yeah, I mean, fetishization is bad.
Yeah.
Yeah, right.
That's why I'm bringing it up.
Yeah. But in general, yes, it is bad. But I don't think it is in this case. In this case, just because they've now been married for 13 years. Like he would have left long time ago.
Oh no! This is amazing. I'm
Yeah.
happy for these two people. I'm happy for anybody
It
that
is
can
such a
find
controversial relationship.
Why is
though.
it
Every time I'm
controversial?
on TikTok, there's a ton of hate.
Why?
A ton of hate on this woman.
Why?
Because she's old. Or
And, like,
older.
but who's hating on her? Women?
Yeah.
Yeah, it's women.
Yeah.
It's not
a lot
men.
of women in the comments saying, because he's in the recent horror movie Nosferatu.
Oh yeah.
Have you seen that poster?
No.
What, you haven't?
What is that?
It's with, what?
I'm like
You don't
living
know
life.
what
I don't-
Nosferatu is,
No.
dude?
What?
No.
It's with Lily Rose Depp, Johnny
Yeah.
Depp's daughter.
All right.
Well, it's a huge movie.
Okay.
And he's in it, and people are saying that,
Muggs, you're getting a call.
people
Go on.
are saying that she's Nosferatu. Like she's a horror. Like, it's really sad. It's
Oh,
really
wow.
sad how many women are attacking her because she's dating a hot guy.
Huh. Yeah.
Yeah,
That's
it is.
weird.
It's really sad.
That's really weird.
I dislike
Why do women
this,
do that
like,
so much?
competitiveness.
Why do
God,
women tear
we were-
each other down like that? I mean, I guess, there's always the devil's advocate that'll see this clip and go, oh, it's men too. But I do feel like women, like I've been in the presence of women and they'll see maybe like an overweight woman with a skinny guy. And like a single friend of mine will be like, I don't understand that at all, And I'll go, well, I don't know. Maybe like she makes him happy, I don't know.
It's socialization. It's just like years and years and multiple generations of socialization of how we should feel, how we should think, how we should be competitive towards each other. And the more you work on yourself and the more enlightened you become, the more empowered you become, you don't do those things. You don't compare yourself to other women. You don't tear them down. But there are a lot of women that don't work on themselves.
Right.
And they have, low self-esteem. And
Yeah.
the best way to feel better about yourself is to talk about other people. Is to...
Well, speaking of women and sexual health, Amy Schumer made a scary sexual confession. Now, what would you deem a scary sexual confession, Dr. Tara?
that she has, like, an uncurable STD.
That's scary. That would be scary.
yeah.
What is an uncurable STD?
AIDS.
AIDS.
I would be scared.
Yeah, if you had AIDS.
Yeah.
I saw something that somebody was saying that like HIV. What do you HIV becomes AIDS? Is that true?
Mm-hmm.
Okay, so I heard something recently where like HIV doesn't always nowadays.
Right, you can treat it. Yeah.
Yeah, where
But
it
when
doesn't
it's AIDS.
transcend into AIDS. But yeah, that would be scary.
Is
Okay.
it? Is it AIDS?
It's not AIDS. Muggs,
Okay.
do you have a guess? No, he's on the phone. Okay. All right. Well, scary.
Yeah.
It's not AIDS. You want to hear it?
Yes.
Okay, listen to this. This is Amy Schumer.
I have never from penetration, ma'am. It's a scary thing to say out loud.
No, it's not.
I mean, it's scary because nobody talks about it, because we're all like, getting an Oscar. But
Getting an Oscar.
But no, I've had generous partners who understand like that, I need to orgasm first. And I know
Yes.
you subscribe to that
100%.
on your Wikipedia.
Okay, so I believe she was on the Call Her Daddy podcast. And so that's, to me, I go, that's not scary. Why
That
is
is
that
not
scary?
scary.
That's not scary,
Yeah.
right? Why?
But
well, I
maybe-
don't want to say,
but
like,
I think-
she might be going through something.
I think we are desensitized because we talk about this on our show.
Yeah, maybe.
But like for the average person, it's probably scary.
Is
to
it
admit,
scary?
like,
Is it
listen,
scary
I've
because like her
never had
exes
an
might hear
orgasm.
this?
Yeah.
Oh, okay.
Yeah, the judgment
Right.
of like, oh wow, so all those times you were faking, right?
Well, why can't women, or why do women struggle, like physiologically,
Yeah,
from penetrative orgasm?
yeah.
Or
because,
sorry, you know what I'm trying to say.
yes, vaginal orgasm.
Yeah.
Because our clitoris is like the penis, and if our clitoris is not stimulated, we cannot orgasm. So if people that completely ignore the clitoris and just like insert and penetrate, it's really, really, really hard to have an orgasm.
Okay.
Yeah, because to have an orgasm, you have to be stimulated clitorally.
Okay. Right on. Sorry, there's a lot going on
A
here.
lot going on. We have a call though for next segment. If you want to go to it.
Yeah. Well, I mean, what do you want me to go to break right now?
Well, we should. I mean, yeah, we're a little behind.
Okay. So okay, we're gonna take a break.
Yep.
And then what do you want to tease what this caller is?
Yeah, it's a great question. She's a young lady from the Valley, wants to know if dating an older man with a kid is a good idea. Not only one kid, but two.
2 kids.
Is this your girlfriend?
Okay, and this is what we're going to break early for. So this better be good, Muggs. We'll get into this call coming up next on Loveline.
Back to Loveline with Kevan Kenney and Dr. Tara. Call or text 833-LOVE-191.
You ready to get kinky? KROQ.
That's a lot to live up to. It is Kevan Kenney, as they just said, with Dr. Tara, and we've been talking about age gap relationships tonight. We were talking about Aaron Taylor Johnson, an actor, and his elder wife. And that relationship. We were also talking about sort of aging out of certain roles in Hollywood and how sort of misogynistic the entertainment industry can be, and the new film The Substance that is out now. Before I get to this caller we have, who wants to know if it's a good idea for a woman to be dating an older man with a child, which is very interesting, don't you think, Dr. Tara?
Yeah, but not uncommon. Lots of women are dating men with children.
We will get to that in just a moment, but first I did want to let you know, if you want to see 9 Inch Nails September 18th at the Kia Forum, and this is very special, it's their return to Los Angeles on this world tour this year, and this is the final stop on the world tour, and KROQ is sending you, all you have to do to win tickets is text the word ONLY, ONLY, to the number 20357. So one more time, if you're driving right now, you love you some Trent and Atticus, all you got to do is type in ONLY and text that to 20357. Now let's get to our friend Asha from Winnetka, right here in the Los Angeles area, and see if we have Asha on the line. Asha, are you there?
Hello.
Hey, how are you? Happy Sunday night.
Happy Sunday.
So lay it on me. What we've understood is you are wondering if it's a good idea for a woman like you to be dating an older man with multiple children.
Yes. First of all, I just want to give a shout out to Dr. Tara.
Hi.
I love you.
Oh, thank you so much.
Yes. Brown women with an MD. We love it.
PhD.
Also, okay, so...
Am I brown? I
Go
don't know.
on, Asha.
Are you?
I'm Asian, so now I'm questioning if I'm brown or not.
Asha,
Well, you're like an off white.
That
So,
works.
Asha.
That works for me.
Yeah. So Asha, me. My situation, so I'm seeing someone, right? I'm 24. He is a little bit older. He's only 26, but he has one biological child, technically 2.
What?
What do you mean technically?
He took another child on. So the woman he had a child by, he took in her other child. So either he has a really big heart or he's like stupid. I'm not sure.
Well, what do you think? Is he a nice guy? Well, first off, how'd you meet this guy?
I met him on Halloween.
Where? At a bar?
Yes.
Okay. What did you go as?
He was. I was actually a vampire.
Okay, what was he?
Nothing.
Oh, he's one of those guys. He doesn't get dressed up?
He's not participating.
I kind of like that.
Okay, all right, that's cool. And then, so how long you been seeing this guy?
Since Halloween. We met on Halloween.
Of this year. Oh, so this is a Halloween of 2024.
Yes.
Okay, very cool.
Very new.
Okay. And then so he's only 2 years older than you. So let's address this kind of in steps. I don't consider that an older man.
No.
Okay. So that
I don't either.
So don't worry about that, Asha. Like, don't worry about the fact that he's 2 years older. That's fine. You were in high school at the same time. Totally fine. So he has one.
Literally, I don't find him like a much older man. I don't even think that.
So he has one biological child. How old's the child?
She's 6.
Okay,
Wow.
so 6. He's 26. So he had him when 20. And then the other child. When you say he has another child, this is the child lives with him.
No.
So what do you mean he has an other child?
So neither children live with him.
Okay.
Okay. Let me give it to you in layman terms.
Okay.
So his baby mama,
Yeah.
right?
Yeah.
Has a baby with his baby mama. She had another kid. And the father for that child is absent. So therefore, he kind of stepped up for that child. And him and his baby mama are no longer together, but he's still
not the father.
there for him.
Wait, so do they have like half custody?
I don't know the linguistics of it.
Yeah,
but
so what I'm understanding is this woman he dated, his ex, already had an existing child, correct?
Yes.
So he starts dating her, and then that child, how old's that child compared to the 6-year-old? Probably 8 or...
I don't know, but I believe he may be like 1 or 2 years older.
Oh, so you
than
haven't even met these
their
kids?
child. No.
Oh, okay. So this is now, do some quick math for me, Dr. Tara. October to now is 3 months.
Yeah.
We're coming up on 3 months on the 31st. So you've been dating this guy 3 months. And are you under the impression that you are exclusive with this guy?
It's seeming that way.
Okay. Would you like it to be exclusive?
And that's why I'm calling, because
you don't know if you want to make it exclusive.
Right. I think he's really cool. I like everything about him. I've had like brief conversations with his daughter on the phone, which is I don't want to say weird. But I remember being a little girl, and I remember being like very protective of my parents, and just like it's just.
So why did they break up?
Myself too much.
Asha, why did he and the ex break up? So okay, so you don't know how old one of his kids is. You don't know why they broke up. I mean, what do you guys talk about when you hang out? What do you guys talk about?
Everything else. I think I've kind of tiptoed and avoided those questions because I was kind of afraid of the answer, maybe.
Yeah. Now, have you ever dated before, or is this your first foray into dating?
No, I've dated before.
Okay. Well, I don't know. Some 24-year-olds haven't.
24.
No, I know. Some people haven't. So are you like that in a lot of your past interactions with men? Like, you don't like to like talk about, the
nitty-gritty?
Yeah, the nitty-gritty, as they say?
I think I have too much, maybe too early, so maybe that's why I'm kind of
now you're a little gun shy. Well, here's the thing.
Maybe a little bit.
It doesn't sound like you're in any position to become exclusive. And if you are not even talking about these, I mean, I don't even know if they're deep things, just sort of chapter 2.
No, they're not.
Yeah. Like, I just think if you were to go to this guy and say, hey, I want to be exclusive, he's not going to, it sounds like he doesn't feel a connection to you either at this point, but I think you should start.
I'm hanging up.
Well, no, I mean, look, it's my opinion, right? I think that if you want, I think instead of wondering if it's bad he has a kid, I think it's bad you guys aren't talking about this stuff. And I think you need to talk about this stuff before you even entertain exclusivity.
Right. I mean, he's definitely brought it up. He's talked about her. He talked about their relationship. I just didn't ask like the narrowing questions.
Well, how does he talk about it? Like, is it positively, negatively?
It's like both, which I feel like is natural, maybe.
Okay. I mean, he liked her enough or had such a connection with these kids. I mean, does he come from a well-off family?
No.
Does he have a good job?
She?
No, the guy you're dating. Does he have a good job?
She has like yeah, He's like, he does like electrical work and stuff like that.
Oh, you
yeah.
actually make pretty good money doing that.
Yeah.
And then what does the ex do?
I have no idea.
Yeah, you got to know these answers, Asha.
Why does she have to know what
Like,
her
but, like,
occupation was?
I don't want to. Yeah, I don't have to. I don't want to pry about.
Well,
the other
here,
Okay,
woman,
I
let,
mean,
me
I
paint,
think you're-
let me paint you a picture that is like a little bit more realistic than, whatever Dr. Tara is about to say, which is going to be like sort of pie in the sky.
What I'm about to say
From
make
what
a lot of
I've
sense.
gathered, from what I've gathered, I assume she does not much.
Okay, so here's why it's important, right? To Dr. Tara questioning me or you questioning me, I can't keep track now. What's important is that if this is a deadbeat lady and she is mooching off of the guy that you want to date, and now he's taking care of both their biological child and then another child, and she has no plans of getting a job or gainful employment or a way to support the child that is biologically hers, then that's going to create issues for you and this guy. And then I don't care what anybody says. If you have children with somebody, there's always a connection there. And there are, if the baby mom is in the picture, I mean, I don't know if this is love of your life, but if the baby mom is in the picture, there are a lot of other options. That's all I'm going to say. I know it sounds cold.
Wait a minute. Let me add this though.
Okay.
Another layer.
Okay.
I believe that she has a partner.
Okay.
I feel like, okay.
How serious though? You know what I mean?
They live together.
So then why isn't that guy taking care of this kid?
Good point.
Well, because you can't just pass on one kid to another. They met each other. He brought this kid on, and like
he bonded with his child. Like this child sees him as his father.
His stepchild.
Yes, exactly. Like a stepkid. Like that's just what it is.
Okay, my question is, how strong is your attraction for him minus the situation, just to him? From 1 to 10.
10.
Your attraction
10?
to him is 10 out of 10.
Dude, no, your attraction to him is a 10.
Is this for real? Asha,
You
is this
said
for real?
outside of this situation.
But
Right,
a
right, right.
10? Like, this is like your dream guy?
Okay, now with the kids in the situation.
Why are you so judgy?
She
10?
said attraction.
Yeah.
What's the number with the kids in the situation, Asha?
What do you mean?
Like, what do you rate him? Yeah.
Did your attraction towards him change with the situation?
Well, because I just don't know how to go about it, which is why I'm calling and asking.
Yeah, of course.
So maybe like 7.5.
So the kids is a big thing because she hesitated there and she
And
said
it is.
10 the other time.
Yeah.
It's not a big thing. It's just that, I don't know. Like, I've worked with kids before. I know how kids work. I just think it's a big thing for them. So therefore, it's like a big thing for me. So I just don't,
And it's a huge part of, like, a relationship needs attention and resources. So him having 2 children, as well as a previous relationship, co-parenting, that's going to take away attention and resources from your relationship. I guess, do you like this person enough to go through all that this year together?
I'm fine with it as
Because
long
it
as
seems like a lot
I
of
don't need to
investment
do
on your
anything.
part. Well, emotional investment and time.
Muggs, can you pull? I don't know if we can do this how quickly. There's a great dialogue from Jerry Maguire between Cuba Gooding Jr.'s character and Tom Cruise's character. And he talks about how when you're dating somebody with a child, it's different, right? Like, you've got to be honest and you've got to,
It is different.
It is different. And so I just want to, like, not to speak for the child, but, I would just say, this should probably be someone that you legitimately, Asha, and again, I just mentioned on the phone, I don't know how good your judgment is, but if, I'm not making, but I'm being serious.
What was the giggle for? Like,
She's in a, can I be honest, Asha? I don't know what she took before the broadcast tonight. She's been giggling at everything tonight.
Not too much on my girl, though. It's fine.
No,
She's
but
fine.
Asha, no, in all seriousness, you need to take it pretty seriously because you are, and I mean this, I don't mean this in a negative way. You are going to disrupt the child's lives in the sense of like, this is a new variable. This is a new element.
Yes.
This is something where children really do cling to consistency when you're growing up, as we all did too. And this is going to disrupt that consistency. So you have to go, why do you like this guy? Why is he a 10 out of 10? And, he sounds amazing. If he's doing this out of the kindness of his heart and he is that much of a man where he wakes up every day at the crack of dawn and he goes and does, trade work and he's putting food on his table and the food on the table of other people's children, including his own, that guy's amazing. I think that's a pretty rare kind of guy. I think you should do it with this guy. But if it's not that.
Oh, I've done it. I'm just kidding.
Was it good?
It was amazing.
Oh, wow. Well, that makes sense.
Are you using protection? Are you using protection?
10 out of 10.
Are you using protection? Are you using protection? No.
You said that like 4 times.
I know, she's not saying anything.
I know. I'm like, not anymore.
Asha, man. What?
Is that?
Are you on the pill?
I am on birth control.
Oh, okay. I was going to say 3rd kid coming in soon.
Does anybody use protection anymore if they're on birth control?
Some people still do, especially if you're like casual.
Yeah.
Yeah.
I have trust issues with people. And before I was like,
when you were single, did you use condoms?
Always.
Yeah.
Like, always.
As you should.
Well, yeah. Yeah, I mean, that's your prerogative, of course, Asha.
I feel like this generation of men, they will convince you not to use one.
Yeah, of course. This guy's already convinced somebody that. You're like, that's what the 6-year-old's for.
Not him.
Yeah, but he's already convinced someone to do that because there's a 6-year-old.
Oh, you're protecting him, so you're like already emotionally attached.
Oh, God.
When's your last relationship, Asha? Before this guy. See, she's got to think about it. There haven't been many.
I'm not. I know the answer.
Then why don't you say it?
So my last relationship was very complicated, and it was about 3 months before I met him that I kind of ended things with that person.
I don't love this now because why was it complicated?
Okay.
Short version because we're on the radio.
Okay, he was a 40-year-old man.
And you're worried about 24? Wait, hold on.
You were 22?
Oh, yeah. No, I was actually 23 to 24 when I saw him.
And he was 40?
Nope, he was 47, 48.
Okay. And where'd you meet that guy?
Can you guess?
A bar. People in these bars.
Is it the same bar as Muggs?
No.
Is it Muggs? Is Muggs? Are you 47?
I am the father.
Asha, can I just because we do have to get to some other questions, and I want to give you the best advice that at least I think I can give you you got out of a relationship that sounds like, in your own words, was a problematic relationship and it was complicated, right? With a 48-year-old guy.
It just wasn't. It was, yeah.
Okay, so then 3 months later, you meet this other guy, and you're trying to make this guy the solution to all of your problems. And the reason I'm so confident in saying that is you told us he is a 10 out of 10 attraction scale, which to me is just so unlikely. And just from an odds perspective, that you would, 3 months after breaking up with this complicated relationship, you would meet the 10 out of 10 guy for you, right? And this guy is very complicated.
Well, I didn't say all that. You just asked me on an attraction scale.
I know, but Asha, what I'm saying is this guy, you may be inadvertently making this guy, you're trying to fit a square peg into a round hole. And this guy might not be the solution you're looking for, but you are probably looking for a solution. But it might not be this guy.
She's thinking about it.
I'm just think about it, because you know what I'm trying to say. It's like,
no, I did also grow up without a father, so maybe I don't know.
Well, and so think about this. You probably so you never knew your dad?
Never.
You never ever met them? Nothing like that.
No.
Okay, so maybe your over accommodation with men, right, is tied to that. Wanting to please a man because you never got the opportunity to satisfy your dad and make your dad proud. Maybe.
I don't think I make them very happy.
You don't think you make the men you date happy?
I don't know. I'm definitely a handful in my own way.
Right. And
I don't think it's easy.
Well, let me ask you this. Do you think you predominantly satisfy the men through sex?
Yeah, maybe.
Right. So I'm just, by the way, no one's judging you here on Loveline. I just think it's helpful for any of us to go, I do that.
Yeah, we listen,
wow,
but we don't judge.
Yeah,
we
yeah.
listen when we don't judge.
There you
exactly.
go. There you go.
Yeah.
So, just maybe be aware of that. Because I think if you're aware of your hang-ups and why you do the things you do, I learned through therapy, I grew up in a crazy, chaotic household. And so when things are calm, I have a beautiful, loving girlfriend who's very calm, right? And when things are a little too calm, I'm like, what's going on?
seek
What's
out
wrong?
chaos,
And
yeah.
yes, and I will create that chaos. Or in the past,
No, I'm very well aware of, like, I remember reading this thing that people that grew up, like, in chaotic, maybe, like, a little dysfunctional stuff, were very drawn to, like, dysfunctional stuff.
yeah.
Because it's, like, familiar
It's
and
familiar.
it's normal. And even if the unfamiliar is, like, healthy and good for you, like, it's weird to us because it's, like, unfamiliar.
100%. This is why people
I'm aware of it. I hate being aware.
No, I know, but please run towards that light of awareness,
Yes,
Asha.
it's good for you.
You don't want to be these people
Thank
who
you.
are unaware. First of all, the people I hate the most in the world are self-unaware people. Are they not the worst people? The people that talk,
Yeah.
they have no idea of how
Zero
awful
self-aware.
they
Yeah.
are. Zero self-awareness. And then
I feel like they're faking because there's, like, no way.
I marvel at it too, especially in this town.
Ugh,
The
I
people
mean,
you will meet in
some
this
of these
town,
people,
and you're
ignorant
just
is a
like,
bliss.
you're in on the bit, right? Like you're in on this, and then you go,
Yeah.
oh no, you're not.
No.
You don't realize how awful you are. So,
And
anyways,
just, like, slowly back away from.
yeah, the Homer Simpson move, of course, of course.
Yeah, in the bush.
No, but if you really just, I think you should run to that awareness because I think it's good, and I think it's good that you've heard that advice. I learned it in therapy of like how much we value the familiar, because that's why people will know I've got a drinking problem, I've got a smoking problem, but it's like the familiar solution is like the smoke, the drink. You know what I mean? And they know.
Why are you looking at me, dude?
No, I'm not. I'm not. I do hope you stop smoking though, because I love you.
Oh, that was a sweet
Tara's
moment.
reaction is like, we just talked about
That
Tara's
was a
reaction. It's like,
sweet moment.
yeah, it was sweet, but she's and then she's laughing when I'm trying to be earnest. I don't know what she drank, but don't drink it again.
I really do think that the situation seems really complicated, Asha, especially for someone so young. Speaking from experience, like in your 20s is such a good time for exploration and also like, a lot of self-exploration, like learning about yourself. So try not to get stuck into like too complicated of a situation and relationship this young, but explore and also grow, because I love this saying the most. Grow a garden and the butterflies will come.
Yes.
Lame.
You want to know what my
It's
grandma?
true.
You want to know what my grandma used to say?
Yes. What
My
did she,
grandma
what
used
she
to
say?
tell me. She used to tell me, "Why make one man miserable when you can make a bunch of them happy?"
Oh, interesting. Well, Mom's like
sounds
that,
like
so
her grandma ran the bunny
if
ranch.
you want to date a 40-something-year-old man with a child, we have one here.
No,
Was
hey,
your grandma Heidi Fleiss?
hey, Asha. In all seriousness, I mean, we're telling jokes here, but you said you're 24 years old.
Yes.
Okay, so I have two questions for you. Number one, what are you passionate about in your life? Like personally, what do you enjoy doing? Do you have a goal, or do you have anything you enjoy doing in your life?
I do.
What is it?
Honestly,
Yeah.
I love making people laugh.
Okay.
I love writing. So honestly, like, I look at my future like endeavors, and maybe it might be something to combine the two.
Okay, like comedy writing or something to that effect.
Yeah, and like I like drinking, so like I think it goes hand in hand. Like
Yeah.
comedy and
Oh
just,
yeah,
like,
yeah.
Every
Okay.
24-year-old loves
here's
drinking.
but also every 24-year-old artist, and you probably are a creative artist, they think they have to be this like tragic character, like they need to drink a lot, or
No, I hate being a victim.
Right.
I hate feeling sorry for myself. I don't like that.
Or like
Okay.
self-deprecation.
Okay, but let me get back
I
on
hate that shit. Oh.
Muggsy, get it. Here's what I just need to leave you with though, Asha, is that you're 24 years old. If you, instead of like trying to please men, or instead of trying to date men or trying to meet men or get the validation of picking up guys or guys choosing you at this local bar? Because I'm sure in the moment that feels great.
First off, I did not meet these two people at the same bar.
Okay, but I'm just saying, overall, Asha, we're trying to give real actionable advice here if you can focus for a moment. So you're 24, and instead of putting your validation and your merit in how many men choose you at whatever bar, because I know that's probably a great feeling, put that validation in writing better and put that validation in honing your comedy skills. And then that's going to be twofold, because then you're not going to ruin yourself and become this jaded person through all these terrible experiences in your 20s, where by the time you're 30, no one wants to date you because of that. And by the time you're 30, you'll probably have a career in comedy or have a career in writing because you took those steps. So I think it's twofold better than kind of being on this cycle you're on now, whether you want to admit it or not, which is you go from one complicated situation to another.
Build a garden and the butterflies will come.
Or do that.
Yeah, again.
Yeah.
Full circle.
Yeah.
How's that? So, Asha,
Okay.
if you, and again, we're always here on, and I don't mean to plug the social, like I'm not saying in a sticky way, but we are always here. Dr. Tara is always there on social, and you can always call back, whenever you want, if you want to talk to Dr. Tara, on Loveline.
Yeah.
Sound good?
Oh, yeah.
Thanks for
Yeah,
calling,
I
love.
totally, of course. I forgot who said it, like what female writer said this, but she also said, like, when you want to talk to a man, you're ignoring your creativity. I do remember that.
Interesting.
I forgot
I
who
feel
said
that.
it, though.
And hey, Asha, if I can just add one other thing, is just from like the dude point of view. I remember meeting a girl who was a comedian, a writer here in Los Angeles, and was very promiscuous and very would just text me very sexually direct things,
Wait,
right?
hold on now.
And so anyways, I almost wanted to tell her hey, you're awesome. You don't need to do all this stuff. I almost felt like she felt like she had to do all. So I'm just saying you might be good enough. You don't have to please all these guys. They might just like you.
But some people might just like sex.
Yeah, I'm like, well, there's not all these guys. Wait a minute. Let's not. Hold on.
Okay, then that's good.
Maybe the girl that texted you just likes sex.
That's fine too, but I mean,
Yeah,
you
why
say
do
this,
you,
but
why do you
there's
make it
reality.
like she's trying to please you?
No, she can like sex, Dr. Tara, but I'm saying there also is a long track record of problematic female behavior that uses sex as a vehicle to please people,
Right.
so that they get validation. Are we going to ignore that fact?
No, that's
Okay.
that's true.
That's true.
But there's
So-
also tons of women that just like sex.
Of course, but on
Yes.
this show, are we going to do a disservice by not acknowledging that there might be concerns with certain types of behavior?
Yeah, I'm acknowledging
You know what I'm
both.
saying? All right. That's all I'm saying. Asha, we love you. We got to run. We're getting the rap sign. Dr. Tara, where can Asha and plenty of other people find you on social media?
Yes, I'm on social media at lovebites.co. That's LUVBITES.co.
Amazing. We'll be back next week with another Loveline.
This has been Loveline. The opinions expressed on Loveline are not necessarily those of staff, management, sponsors, or the station.
Loveline is produced and engineered by Jonathan Beermug Cantrell. Loveline is a presentation of the world famous KROQ.